Welcome everyone. In this video, we present the surgical management of an 8-year-old girl with a visually significant corneal scar, high regular corneal astigmatism, cataract, and dense amblyopia. Following the creation of the corneal incisions and injection of the viscoelastic into the eye, the anterior synechia are carefully released. A continuous curvilinear capsulorhexis is then performed, followed by gentle hydrodissection. Phacoemulsification is carried out with meticulous preservation of the capsular bag. The residual cortical material is thoroughly aspirated, providing a clean and stable capsular bag for intraocular lens implantation. A Technis Eyhance Toric intraocular lens is implanted into the capsular bag. After complete removal of the viscoelastic, the lens is carefully rotated and aligned with the predetermined toric axis to achieve optimal correction of the corneal astigmatism. Accurate alignment is critical, as even minimal postoperative rotation can significantly reduce the effectiveness of astigmatic correction. Following secure closure of the main wound with a 10-0 suture, we proceed with pinhole pupilloplasty. An end-opening microforceps is introduced through the paracenthesis, grasp the proximal iris leaflet. A 10-0 polypropylene suture on a long needle is passed through the proximal iris tissue through the opposite paracenthesis. A 26-gauge needle is advanced across the distal iris leaflet. The tip of the polypropylene needle is docked into the lumen of the 26-gauge needle, which is then withdrawn. Externalizing the suture. Using a Sinskey hook, a loop of the suture is brought out through the paracenthesis. The free end of the suture is passed through the loop 4 consecutive times in the same direction, creating the single pass 4-throw knot. Gentle traction on both ends allows the knot to slide smoothly into the anterior chamber, precisely approximating the iris tissue and creating a small centrally positioned pupil. The excess suture is then trimmed using intraocular microscissors. To achieve a precise and standardized aperture, the pupillary opening is subsequently refined using a vitreous cutter. The aperture is carefully fashioned to a final diameter of approximately 1 mm, resulting in a well-centered pinhole pupil. This small aperture functions as a natural pinhole, reducing peripheral aberrant light rays, minimizing the optical impact of the corneal scar, improving retinal image quality, and increasing the depth of focus. The final appearance demonstrates a well-centered intraocular lens with a perfectly centered 1 mm pinhole pupil.